Actually, when you talk of speech-language pathology, it's a vast field. It's so vast that you can't just demarcate one area. And when you're talking of speech and language, it definitely cannot miss the hearing part, because speech and language is going to come in when there is a hearing. And so audiology is what comes along with speech-language pathology. They go hand in hand. Now, speech and language itself, actually, it covers up basically, if you look at it, it's communication. So all of this comes into communication disorders, where it affects a person's quality of life because of inability to communicate. And what is communication? To be able to share, to be able to express, and to be able to receive.
Correct.
So the baseline of all this comes as receptive and expressive. So to add on to this, let's look at speech and language disorders by looking at it pediatric as well as geriatric. It's a whole gamut of it. Speech disorder means totla bolta hai, popra bolta hai, atakta hai. They can't think of anything beyond that.
Correct.
But let me clarify on that. So when it comes to pediatrics, basically, I'm going to look at it from the language concepts of it. So if you're looking at the language, there could be a child who is not speaking at the age appropriate level, and that's what we call as delayed. If by around 18 months, if the child is still not speaking, there's a little concern. So that you need to visit a speech language therapist to be able to understand what is the cause. It could be as simple as environmental causes. It could be lack of stimulation. But there could be something more to it, which can be missed. And if you don't have the early intervention, we are missing on the developmental age. The other aspect is a deviant language development. It doesn't follow the norms of development. And so a child may be speaking a little bit or singing, and the parent feels, oh, my child is talking. But he's not actually conversing, not being able to talk, to communicate. He's using words offhand, but not using those words meaningfully and intentionally. As we now recently hear a lot of kids having the spectrum disorders, so the autism spectrum becomes a part of it. There could be attention deficit, but the child is not able to learn to speak because of lack of attention. There could be intellectual deficits, so the cognitive levels are low, and that could be the added to it. There could be speech language disorders which could be associated with disorders like cerebral palsy. It's a motor neurological problem. There could be cleft lip and palate, which will have, may have language or not. There is more commonly nowadays, we're seeing much more, is the apraxia of speech, where there is a difficulty of voluntary producing speech, expressing it. And very, very often, which we miss always, is the swallowing disorders. Children, people think they're fussy and they're not eating. Now, there could be many causes. There could be sensory problems, but there could be actual swallowing as an issue. That at times, there's a need of other disciplines also to be there. So we're a team. The team extends, as I said, from the child, but it can be the medical team, like the pediatrician, the neuropediatricians, psychiatrists, psychologists, depending on the need, the occupational therapist, the physiotherapist, the speech language therapist, the teachers later on. When you're talking for inclusion, it's the school teachers who also come up into it. Well, language perspectives are lots as far as language is concerned, and we are seeing it happening more because of the lifestyles. We're seeing more of strokes, the neurological. Basically, it's the neurological problems. So post-stroke, post any motor neuron disorders, there's a range of it. But it's neurological aspects which could cause things like Parkinson's, where you have speech-language disorders, where you have the dementias and Alzheimer's. They need help on communication. We have, again, what we call as aphasias due to the stroke, where the person may not be able to either understand or express. And very important, again, here is swallowing. There's a whole range of speech disorders which would be in both the groups. The most commonly occurring, which you see in children, would be totla bolta hai, not clear. Like the k's may be a t's, or the r's may be a l's. And so it doesn't sound very intelligible. And that affects the child's communication. And what I mentioned is only articulation disorders, which is which also includes when you talk of a lisp. A person is talking with a mild lisp. Articulation is one part. There is fluency disorders. Fluency disorders are where we have a rate of flow of speech. If that flow of speech is interrupted with some hesitations or repetitions, mind you, we all do that, but very little. When it is more, and it is a disorder, which affects communication. You might find that a person is suddenly talking and quiet, and you will feel he doesn't want to talk. It may not be there. If the person has the fluency problems, he might be struggling to get the words. What we have is disorders of voice. Voice is the most important thing. You recognize a person by the type of voice, the quality of voice. You're talking on the telephone, you'll say, oh, hi, even without knowing the name. And that's where it's important. So voice deals with three major aspects. One is the quality, one is the intensity, one is your resonance. These are two technical terms. But intensity means somebody is speaking very softly, or somebody is speaking all the time loudly and doesn't know how to modulate it. You go to a discotheque or a mall, you'll naturally raise your voice. But when you're out of it, you'll naturally lower it. But a person with a disorder may not be able to do that. The same way if a person is talking very softly, it's not audible. It will affect his communication. The quality disorders would be where post picnic, post too much of talking, you lose your voice. And you say, oh, I shouted and screamed. Yes, that's hoarseness of voice, but that's a temporary phase which may rectify. But if hoarseness of voice continues, it is a disorder. It needs to be checked by an ENT specialist to see the vocal cords, what is the condition, and then see what the treatment is needed, medical or therapeutic later. It could be a breathy voice. There could be various disorders depending on how your laryngeal functions are affected. Taking this part of it with voice, I would like to talk a little bit on what is called as laryngectomy. Because that's the place where, due to CA or the cancer or any infection, tumors over there, at times the larynx is removed. Either it's partially, completely, it depends on the conditions. And then the person's ability to talk changes. With the resonance, many people talk a little bit from the nose, the nasal twang. And if it is excessive, it is a disorder because it will affect your sounds, it will affect your clarity. The other part is what we have is a neurological problem, but it's also a speech which goes down with as dysarthria, where there's a little slurring of speech, where it's a neurological component, but it has to be attended to. So we need to intervene ASAP as soon as a disorder is identified. Speech is so important in day-to-day life, in professions, and as an adult, when a person grows, then he's got to be inclusive and interact, because everything is group discussions nowadays. Everything is looked at a group. And if I'm not able to communicate, it's going to hamper. There could be people misunderstanding you. You might feel conscious of it. You might avoid talking, and that interferes in your progress. Speech and language disorders can be diverse. It covers up a lot of areas. And it also manifests in different areas, right from childhood to adulthood. But then most important is quality of life. For a child, in a school, in a house with friends, for adults, in society, in the workplaces, with their colleagues. So we, as the members of the society, we definitely need to be inclusive. It's such a big thing, inclusion, but are we inclusive? A person with a challenge immediately catches attention to the public. You'll immediately look, or you'll smile, or maybe you'll make an expression, and that individual is so sensitive, it's going to affect. If it's a child, a response from the other students. If it's a person in the office, his colleagues. So let us be more aware and more empathetic. I do not want you to be sympathetic. Nobody wants pity, but they want to be understood. And if you can't understand, maybe ask them. They'll be able to explain the challenges. But we need to cover up this area of giving them enough time to speak, giving them the opportunity to express with whatever challenges they have. And that's the best thing which you can do. Some of the teaching materials which we can use, therapy materials, I would say, are different types of toys and aids which can help them in learning speech and language. Toys, picture cards, flashcards, books. The therapy aids and the materials depend on the needs of the child, and it has to be planned with the targets which you have. So sometimes you have very big pictures, sometimes you have smaller pictures, and sometimes there's still smaller flashcards. So depending on what the child wants. Depending on the level of functioning and the strengths of the child, you choose materials ranging from flashcards, books, pictures, toys, teaching aids, puzzles. One piece puzzles to ranging to multiple piece puzzles. My suggestion to the parents is just don't go to the market and pick up all this, because they have to be adequately selected, keeping in mind the needs of the child and with advice by a professional. This is, as I mentioned, that hearing and speech and language go hand in hand. The hearing assessments can be done in an audiometry setup. This is a very small setup where you have an audiometer and it's a sound treated room where the assessment can be done. But in a hospital setup or in other private setups, you can have more done. Hearing assessment for children, fortunately nowadays, has become more or less mandatory at birth, and especially for children with high risk. They need to be assessed so that the development is taken care of, and the parents need to be in regular touch with the medical professional to regularly update the assessments. Very important to understand that therapy is individualized, depending on the needs of each individual, a child or an adult. So it's always got to be assessment to understand and then do the therapy.